I get patients all the time who ask me, does auriculotherapy really work? As most of you know, I've been working in the acupuncture industry for about 10 years now and working in the modern technology aspect of acupuncture. So I've been using Acugraph for nearly 10 years in my clinic, and I have a way to measure the progress of my patient. So I can tell whether or not the treatment that I am doing is working, not only because my patients are getting good results, but because I can see the progress within a graph. So when I began using Pointoselect, it was very curious to me, what's going to happen with the graph when I use the Pointoselect? I was at my clinic and I had a friend of mine call me up, and she had a migraine headache, and she said, "Kimberly, can you fit me in?" And I said, "Sure." So I arranged my schedule and I brought her in, and she'd been suffering for days with a migraine headache. And I said, I'm actually doing a little bit of research. Do you mind if I try this new tool on you? She was a friend and coming in for a free visit, and she was happy for whatever I wanted to do as long as I could bring her results. So I did a graph on her, and any of you that know Acugraph, she had an extreme belt block issue. Excess in the upper body, deficient in the lower body, and she had all of the typical symptoms of a belt block of that direction. And she had anxiety, and she had pain, and she had the throbbing headache, and it had been there for days. So she laid on the table, I dimmed the lights, and I did my typical ear scan, and I treated what I found in the ear. When I was done, I said, "How do you feel?" And she looked at me and she said, "My headache is like almost gone. It's like 80% better than it was before we started." I said, "Do you mind if I graph you one more time, because I just want to see the difference?" Now typically, I'll just put a little disclaimer here, typically when I'm graphing a patient or treating a regular patient, I don't graph them, treat them, then regraph them. I decided to go ahead and do this as an experiment. Well, I regraphed the patient, and she was completely green except for one imbalance. To see instantaneous, within 15 minutes of her walking into my clinic, her headache was gone by 80% and the graph had changed. Those are the two things that have been my defining factors in my practice. One, can I change symptoms? Two, can I change the acupuncture meridians in the body? And that's what Acugraph measures. So the fact that Pointoselect, by scanning and treating the ear, changed what was happening in the body, it absolutely works, and the proof is two ways. One, it changes symptoms, and two, it changes the acupuncture channels.